Hello there, I'm Matthew Gibson, MD, and today I'm inspired to talk to you about what to do with strained muscles. I overexerted myself a little bit during yard work this weekend, and I woke up this morning with some terrible neck pain. That's already starting to get a little bit better, I'm glad to hear, but I thought I would tell you about some of the things that do work and some of the things you might want to avoid. So, first of all, is kind of how does this happen? I'm going to show you my little friends over here. Myosin and actin, these are sort of muscle fibers, and what you'll notice is these heads here kind of grab onto these filaments in the muscle fibers. That's kind of what happens. They're all sort of grabbing onto each other and pulling on a molecular level. And when you strain a muscle, then what happens with that is you're actually kind of pulling and stretching those, and you're actually injuring the filaments. And then the response to that is your muscle will then try to hold itself together. Kind of like if you break a bone, you want to cast yourself, kind of keep that bone in good alignment so that it can heal. The muscle kind of does that to itself and tries to hold itself tight and strong. Unfortunately, that tightness is painful. And that's usually what is the most problematic, right? So you have inflammation that's caused by the initial injury, and then also the muscle tightness itself is painful. So you want to make sure that you're treating the right thing. Now, here's one thing that I would caution you about. A lot of times people think that they need muscle relaxers in order to treat that pain. And they can be effective, but here's why, right? So the muscle is trying to hold itself together. That tightness in the muscle is painful, right? I'm feeling it right now. My muscle right here is tight and painful. A muscle relaxant will fix that problem, but then you get the problem where you're basically going to prolong healing time because that muscle is trying to hold itself together so that it can heal. So if you relax it, okay, you'll have pain relief, but it's going to take longer for that muscle to heal itself. So you're trading off pain relief in the short term for it taking longer to heal in the long term. Sometimes you need that. About a year and a half ago, I strained my levator scapulae muscle sleeping. Apparently I'm old enough for that. That happened. But, and I definitely needed muscle relaxant for that. I use cyclobenzaprine or Flexeril for that, but you can also use baclofen. It's a double-edged sword, though, and you have to be cautious about when to use it and when not to use it. So what I would recommend largely is anti-inflammatories. So I use ibuprofen. I use 600 to 800 milligrams. There's not a whole lot of evidence that 800 milligrams is better than 600 milligrams, but I usually just hit the 800 milligrams. And you hit that 3 times a day for at least a few days, depending on the severity of the injury, right? If it's still bothering you, just hit it. Even when it starts to feel a little bit better, just hit that anti-inflammatory kind of around the clock. As opposed to just as needed dosing. You'll probably stay on top of it better if you do around the clock dosing. You could also use naproxen or Aleve. That's only twice a day, so it's a bit more convenient. And there's some prescription ones like Sulindac or meloxicam that are once a day, and that's the big advantage of them. There's not really any evidence that those are superior anti-inflammatories. They're just kind of more convenient because you only have to dose them once a day. The downside in terms of convenience is that you do need a prescription, at least for the Sulindac. Not positive about the meloxicam, but I think so. Not every pharmacy is going to carry them. And so you may end up kind of having that problem of, waiting to get those filled at the pharmacy because they have to order it and you have to get it in. And I usually find it's just not that much of a benefit to do those. So I usually just stick to ibuprofen. You do have to be cautious that ibuprofen and other NSAIDs can be upsetting to the stomach, so you usually take it with some food, and especially if you have high blood pressure, you don't want to be taking those longer than a couple weeks because they can cause irritation to the stomach lining or gastritis, and they can elevate your blood pressure. But that's just if you're using it around the clock for more than a couple of weeks. So if you are using it less than that, you're probably fine. Other things to do, really use topical treatments. So this morning I used Icy Hot, which is a menthol-based topical put on there because that's what I had available. I also am a big fan of Tiger Balm or other camphor-based topical products. Those are they're the smelly ones that cause that kind of tingling sensation on there. So Icy Hot, Bengay Bengay is topical anti-inflammatory, and there's other topical topical anti-inflammatories like Voltaren or diclofenac. You can use any of those. The anti-inflammatories will help in the same way that ibuprofen does, but the Icy Hots or Tiger Balms or other menthol camphor-based products are going to essentially overstimulate the nerves in the skin, and that can provide kind of a distraction. Essentially, because the pain is mostly a little bit deeper down, but a lot of the pain gets transmitted by the nerves that are in the skin. So even though the skin isn't the problem, by overstimulating those nerves, you can then get some relief from the pain. Again, it's not really doing anything to treat the underlying problem, but you can get pain relief from those. So those can be a really good thing. Massage is great, and slow, gentle stretching like that, which feels good. Hurts a little, but that slow, gentle stretching is really important to do. It's also just as important not to do any fast wrenching movements of the muscle that's bothered. Because if you do those sharp wrenching movements, like in chiropractic, then you're actually going to set the muscle back in terms of healing, because whatever healing is being done, you're basically going to re-tear it. So really avoid chiropractic for these problems, and the benefits and risks of chiropractic for other things we'll have to save for another video. But I would very much avoid that. I would say that the evidence is the jury's still out for things like TENS units, and that are going to cause muscle contraction and stimulation. I think probably for that, the pain relief is again coming from overstimulating and overloading the nerves, and thus you may get some relief from pain because of that. But does causing all of that more muscle contraction then lead to delayed healing? I haven't seen evidence of that, but I would worry about that and be skeptical. So keep that in mind. It might be helpful, but it might be more problem than it's worth. Massage is great. Ice and heat, again, they're not really going to do a whole lot to treat the underlying problem, but they can give you some pain relief. And as to which one to do, really whichever one feels better to you. As opposed to when you like sprain an ankle, for example, and you have that big swelling response. Immediate ice is the right way to go with that. That's going to decrease that initial inflammatory response. Ice or some other cold application is what you want. If you've strained a muscle, ice or heat, whichever one feels better is going to be the best way. And if it's lasting more than a couple of weeks, or if the pain's just intense enough, go in to see your doctor about that. And they may prescribe a course of physical therapy, which again is going to start with the same sorts of things: gentle stretching, some massage, maybe TENS. And then from there, as you start to heal, you'll work on strengthening the muscle that was affected and then strengthening the surrounding muscles so that you're less likely to injure yourself again in the future. Because a lot of muscle strains come in the first place because the muscles are sort of weak or not holding things together the way that they should, especially if we're talking about low back pain. That's one of the biggest issues there. Get through the acute phase, and then after that, you really want to train up those muscles. Especially in America, we have a lot of problems with having our postural muscles weak, and you have to really train those, or that's part of why we're so prone to low back injuries, is because those muscles are strained, and when we start working them, they're tender. There is pain there when you start working them, and we get the illusion that we're injuring ourselves, when that's not the case. Outside of that acute phase where you've acutely injured them, it's going to be uncomfortable to work on them, but that's how you're going to break the cycle of low back pain if you have a chronic issue with that. So I think that's about all that I have. There's a lot more that could be said, of course, and feel free to leave some comments, ask some questions, leave some responses. In any case, I'm wishing you all the best, and I hope your muscle injuries recovers as fast as mine does. I'm hoping that for myself as well. All right, take care.